Take your socks off right now. Seriously. In the next 10 seconds, I am going to show you how pressing just 3 specific spots on your foot could reveal if high blood sugar is silently destroying your nerves. Grab a pen and let us test it together. Most people think foot numbness is just a normal part of getting older. They sit in their living room feeling that familiar tingling, that pins and needles sensation, and they write it off as fatigue or bad circulation from sitting too long. But that assumption is incredibly dangerous. Your feet are at the very end of the longest delivery route in your body. When your blood sugar is consistently elevated, it acts like a slow, corrosive acid on your blood vessels and nerve endings. By the time a traditional blood test confirms you have a serious problem, the damage to your peripheral nerves has often been quietly progressing for years. You do not have years to wait. You have today. That is why we are going to bypass the waiting room and do a sensory and circulation check right here, right now. You do not need medical equipment. You just need your own hands, a pen, and 10 seconds of focus. This simple routine is something I wish every single one of my patients had done before their symptoms became irreversible. If you fail the tests we are about to do, especially the second one on the arch of your foot, you are in the highest danger zone for diabetic nerve damage. The warning signs are already painted on your skin, hidden in how your tissue reacts to pressure, and buried in the sensations you either feel or, terrifyingly, do not feel at all. So, if you are sitting on the couch or lying in bed, I need you to pause. Take off your shoes. Take off your socks. Look at your bare feet. Get a pen with a clicker, but do not click the ink out. We are going to use the smooth plastic tip. Get ready, because we are starting with the furthest point from your heart, and the truth is about to be very clear. Now that your feet are bare and you have your pen ready, we are moving to step 1. Look down at your big toe. Specifically, look at the fleshy pad right on the bottom of it. This exact spot is incredibly important because it is physically the furthest point away from your heart and your spinal cord. It is the absolute end of the line for your nervous system. If the electrical signals in your body are starting to fail, they do not fail in the middle first. They fail at the very edges. So if the signal is dying here, the silent damage has already begun. Take the smooth plastic tip of your pen, or your thumbnail if you do not have a pen, and I want you to press it directly into the center of the pad of your big toe. Press down firmly, not enough to pierce the skin, but enough to create real pressure. Hold it there for exactly 3 seconds. 1, 2, 3. Now let go. What did you just feel? If your nerves are completely healthy, you should have felt a very sharp, distinct, and localized point of pressure. It should feel exactly like what it is, a hard piece of plastic pressing into your skin. But here is the terrifying reality for millions of people walking around right now. When they press that exact same spot, the sensation is not sharp, it is muffled. They tell me it feels like they are pressing through a thick pair of wool socks, or like their skin is wrapped in layers of cotton. Some people feel a dull, wide ache instead of a sharp point, and some feel absolutely nothing at all until they press so hard it bruises the tissue. If you felt that muffled, cotton-like sensation, your body is sounding a massive alarm. Here is exactly what is happening inside of you right now. Think of your nerves like the electrical wires running through the walls of your house. Every single wire is wrapped in a protective plastic coating. In your body, that coating is called the myelin sheath. It is what allows the sensory signal to travel at lightning speed from your toe all the way up to your brain. But when you have chronic high blood sugar, your blood becomes thick and inflammatory. It acts like a slow dripping acid on those delicate wires. Month after month, year after year, that extra glucose literally eats away at the myelin sheath. The protective coating crumbles. The wire becomes exposed, frayed, and severely damaged. When that happens, the electrical signal trying to go from your toe to your brain gets lost along the way. Your brain never gets the clear message, which is why a sharp pen feels like a soft ball of cotton. Doctors call this peripheral neuropathy. It is a slow, quiet thief that starts at the very tips of your toes. Think about what that means for your daily life. If you cannot feel a sharp pen right now, you will not feel a sharp pebble in your shoe. You will not feel a piece of broken glass on the floor. I have had patients come in with deep wounds on their feet that had been there for weeks, and they had absolutely no idea because their toes had stopped sending warning signals years ago. This is why you cannot ignore a muffled feeling in your big toe. It is the canary in the coal mine. But the nerves are only half of the story. The other half is the supply line keeping those nerves alive, which brings us to the second spot on your foot. You have just tested the electrical wiring of your foot. Now we have to check the plumbing. The nerves we just talked about cannot survive without a constant and powerful supply of oxygen and nutrients. So for step 2, you can put the pen down. You are only going to need your thumb and your full attention. Look at the arch of your foot. This is the curved area right in the middle of your sole. This area is rich with tiny blood vessels called capillaries. They are the microscopic delivery roads that feed the tissue of your foot. What we are going to do right now is called a capillary refill test. Doctors use this in emergency rooms every single day to instantly check a patient's blood flow, and you are going to do it right now on your own couch. Take your thumb and press it as hard as you comfortably can right into the center of the arch of your foot. Keep pressing. What you are doing right now is physically forcing all the blood out of those tiny microscopic vessels. You are squeezing the blood away. Hold it there for exactly 5 seconds. 1, 2, 3, 4, 5. Now, before you let go, look closely at the skin around your thumb. When you release the pressure, that spot is going to be completely white. That is because the blood is gone. Your job is to count exactly how many seconds it takes for that white spot to turn completely pink again. Ready? Let go and count the seconds. 1, 2, 3. Did the pink color rush back instantly? Did it take 2 seconds? Or did it take 4, 5, or even 6 seconds for the color to fully return? If the pink color returned in under 3 seconds, your blood vessels are elastic and your circulation is strong. The blood rushed back in exactly like it is supposed to. But if you watch that white pale spot linger on your skin for 4 seconds, 5 seconds, or longer, you are looking at visual proof that your blood is struggling to travel through your body. Your blood vessels are failing to deliver oxygen efficiently, and that is a massive red flag for hidden diabetes or prediabetes. Let me explain exactly why this happens and why it is so dangerous. When you have elevated blood sugar levels over a long period of time, your blood changes. It actually becomes thicker and more viscous. At the same time, the excess glucose acts like sandpaper on the delicate inner lining of your blood vessels. This lining is called the endothelium. As it gets damaged, the vessels become stiff, narrow, and inflamed. Imagine you are trying to water a garden with a hose, but someone has stepped heavily on the hose right in the middle. The water is still trickling out, but there is no pressure, and the plants at the very end of the garden are not getting enough water to survive. Your feet are those plants at the end of the garden. They are the furthest point from your pumping heart. When your blood vessels become stiff and narrow from sugar damage, the fresh and oxygen-rich blood simply cannot make it all the way down to your feet in time. This is why your feet might feel freezing cold, even when you are under heavy blankets in the middle of summer. The internal furnace simply cannot reach the room. This poor circulation is exactly why small blisters or tiny cuts on a diabetic foot can quickly become a devastating emergency. If you get a small wound, your body needs to send white blood cells to close it. But if the roads are blocked, the repair crew never arrives. The wound stays open, it becomes infected, and that is how people face severe consequences over a tiny blister. If your capillary refill took longer than 3 seconds today, your foot tissue is currently suffocating. It is starving for oxygen right this very moment. The roads are narrowing. This is not a sign of getting older. It is a sign that your vascular system is under heavy distress. But there is one more vital organ we need to check, and its warning signs are hiding right in your heel. We have checked the electrical wiring. We have checked the plumbing. But there is one more critical system we need to test, and this one might be the most important of all. because it connects your feet directly to one of the most vital organs in your entire body, your kidneys. For this third test, I want you to look at your heel and your ankle. Take 3 fingers, your index finger, your middle finger, and your ring finger. Place them right on the fleshy part just above your heel bone, slightly toward the inside of your ankle. I want you to press down firmly into that tissue. Hold it there for exactly 5 seconds. 1, 2, 3, 4, 5. Now, pull your fingers away and look closely at the skin. Did your skin bounce right back instantly, like a rubber band? Or did your fingers leave deep, visible dents in the tissue that are staying there for 5 seconds, 10 seconds, or even longer? If those indentations are lingering, you are experiencing something doctors call pitting edema, and I need you to listen to me very carefully right now. That is not fat. That is not just your feet being tired from standing all day. That is fluid, trapped, stagnant water pooling in the lowest part of your body. Why is this happening, and what does it have to do with your blood sugar? Think of your kidneys as the ultimate filtration plant for your entire body. Every single drop of your blood passes through them to be cleaned. But when your blood is saturated with excess glucose, day after day, month after month, your kidneys have to work massive amounts of overtime. The delicate microscopic filters inside them, called nephrons, become severely damaged by the heavy workload and the constant sugar toxicity. When your kidneys start to fail quietly, they lose their ability to regulate fluid and sodium balances properly. They cannot flush the water out into your bladder fast enough. The excess water has nowhere to go. So, gravity simply does its job and pulls that heavy fluid down to the lowest point in your body, your feet and your ankles. By the time you are leaving deep fingerprints in your ankles, your kidneys are essentially screaming for help. They are drowning in excess fluid they can no longer process efficiently. The terrifying part is that early kidney damage has almost zero visible symptoms. You do not feel pain in your kidneys at first. You see it right where you just pressed your fingers. People walk around for years with swollen ankles, wearing compression socks, buying wider shoes, thinking it is just a sign of getting older or a side effect of gravity. It is not just getting older. It is a massive warning sign of a systemic breakdown hiding in plain sight. If your ankles are swollen and you left a dent in your skin today, your body is begging you to intervene before the damage reaches the point of needing dialysis. But what if you did not leave a dent? What if your skin bounced back and you felt no pain during any of these tests? If you passed all 3 of these physical checks, you might be letting out a sigh of relief right now. You might be thinking you are completely safe. But I need to warn you about the most dangerous illusion of all. Sometimes the absolute worst sign you can have is feeling absolutely nothing. If you just pressed all 3 spots on your foot and felt absolutely no pain, no sharp points, and left no lingering dents in your skin, your first reaction is probably profound relief. You might be thinking, "Thank goodness my feet are fine. I have nothing to worry about." But I need you to listen to me very carefully right now. Because sometimes the most terrifying symptom you can possibly have is the complete absence of feeling. If you pressed the tip of that pen into your big toe earlier and felt absolutely nothing, you did not pass the test. You failed it in the most dangerous way possible. Feeling pain when a sharp object presses into your skin is a good thing. Pain is the language of a living nerve telling your brain that it is under attack. Pain means the wire is still connected. When you feel nothing at all, it means the nerve is completely dead. The wire has been severed by years of high blood sugar. The protective coating is not just damaged anymore, it is entirely gone. This is the absolute highest danger zone for diabetic nerve damage. Without pain, your body has no way to warn you when you step on a piece of glass, or when a tiny blister turns into a life-threatening infection. And here is the cruelest twist of this entire condition. Even though your feet feel completely numb to the outside world during the day, they might actively torture you from the inside out at night. My patients constantly tell me that as soon as they lie down in bed, their numb feet suddenly feel like they are on fire. They describe a burning, electric shock sensation that makes it impossible to sleep. Doctors call this phantom nerve pain. Your nerves are severely damaged, so they start misfiring. They send chaotic, broken distress signals up to your brain. Your brain does not know how to translate these broken signals, so it interprets them as severe heat or intense burning. Your feet are not actually hot. There is no physical fire. The fire is a phantom created by a dying nervous system. If you have numb feet during the day and burning feet at night, your nerves are actively crying out for a rescue. The damage is severe, but if you take action immediately, it does not have to be permanent. If you failed any of those tests today, or if your feet are burning in the middle of the night, I need you to take a deep breath. Do not panic. Peripheral nerves have the incredible ability to regenerate and heal, but you have to stop the damage and start the rescue process tonight. You need a daily action plan, and it only takes 5 minutes. First, we need to force the blood back into those tiny, starving capillaries. Tonight, when you sit on your couch, lift your bare feet off the floor. I want you to pretend your big toe is a pen, and I want you to draw the entire alphabet in the air. Trace every single letter from A to Z. This specific rotating motion acts like a massive pump, forcing fresh, oxygenated blood all the way down into your dead zones. Second, you have to give your body the exact materials it needs to rebuild that damaged nerve coating we talked about earlier. Eating less sugar is just the baseline. You need to ask your doctor about 2 specific nutrients, alpha-lipoic acid and vitamin B12. Clinical studies show these are the exact building blocks your body uses to repair frayed nerve wires from the inside out. Finally, I need to give you a strict warning. If you have an open cut or a blister on your foot that has not closed after 3 days, or if your foot is completely numb right now, you need to call a podiatrist tomorrow morning. Not next week, tomorrow. You worked your entire life for your independence. Do not let a silent condition take away your ability to walk, travel, and enjoy your family just because you ignored the warning signs. You have the power to turn this around today. If this 10-second test opened your eyes, please send this video to your spouse, your friends, and anyone you love who might be at risk. Hit that subscribe button right now so we can keep protecting your health together. Take care of your feet, and I will see you in the next video.